me get my microphone on. There we go. All right. So, as I was saying, I'm a practicing endodontist. Been practicing since 2005. My company's Greater Endodontics. This is my actual operatory. And I'm going to walk you around the room and go over how I use a microscope, with the tips and tricks that I've learned with the microscope, and just kind of some positioning things, some parfocaling tricks, and just kind of really introduce you to kind of how do you be really fast and efficient with this microscope. So I'm going to introduce my staff. Vicki, do you want to come in here and say hello? This is going to be my assistant Vicki and Lindsay. They're going to be debuting positioning around this office or in the chair and how we work. So which one's going to be the mouth model?
Me.
Which one's going to be the assistant? All right, there you go. All right, so first things first, let's talk position. The position of the microscope. Now, I've done a few offices throughout my career, and that microscope has actually changed positions. Right now, I have it on the right side wall of the room. So if we think like a clock, the head of the chair is 12 o'clock, and then you can do the math. That's 6 o'clock, 3 o'clock, 9 o'clock, 12 o'clock. So I'm over here at the 3 o'clock position. Now, I've actually have done it at the foot of the chair, here at the, Mike. I've done it here at the foot of the chair, and I've done that kind of more at the 6 o'clock position. And I've had it to where a few things. I've done it from the ceiling, and I've actually done it from the floor right here, almost like where this arm is. People get creative. There's a lot of different configurations, but I'll tell you the one thing to learn from that. One is vibration. So if you have a floor as you walk around and there's vibrations, we have a lot of traffic. Right now it's early morning, but you'll see as people come in throughout the day, because we are still practicing, we have 2 other doctors here. You don't want a lot of walking. If you're on the floor, inevitably you're going to feel footprints as people stand, especially on a hard surface such as what I have here. So that's one thing. The other thing is if you go from the ceiling, you really need to reinforce the ceiling for the same thing. If your building has compressors and things, right now I'm on the 2nd floor of the building, and sometimes that's an advantage. However, I've had a lot of luck from the ceiling. This office, I went to this 3 o'clock wall right here. And partly is because in this operatory room, I wanted it to be very open, and it's very clean and light. I've also done behind the patient's head, the 12 o'clock position. And that's also creates a very open feel. Now, the advantages of 12 o'clock are it doesn't matter if you're right or left-handed, and I'll show you what that means here in a minute with positioning around the chair. But the 12 o'clock, the problem is when you mount a microscope here, the arm has got to come somewhere. And so, Lindsay, do you want to sit right here? Or just stand right here? If I have a microscope arm come through here and I'm working at this patient's chair, then what happens is it blocks our view. So it kind of makes you feel kind of locked in. And if my environment, if I'm right-handed and I'm looking this way, then it makes sense to have it over on your right shoulder. But then you're blocked in. You have to move if you get up and move and go to another room, this is what I do. I'll walk out here and come here. And inevitably, that movement in my office is why I ended up putting it here on the 3 o'clock wall, because I can always push it back, walk out, come in, and bring it back down. And that will address the issue of parfocaling here in a second. Okay. So that was why my decision ended up being here on the 3 o'clock wall. Now the second thing is, let's take a look at this microscope. So arms and cords and things, that's really going to be room length. There's always a ton of configurations that you can do with that. And there's also configurations where people will go high mount, low mount. We talked about ceiling and floor. But I like it where when I'm sitting, that it's just in my reach. So if I'm working like this, I want to be able to reach and bring it over. And I can put my patient down, my pretend patient. Do you want to give me a patient? Yep. All right. Yep. So I can put my patient down. Rest your head back, please. And this way, I'm always in this motion. Like it's always, I'm sitting, it's very comfortable. I can bring it over. And the first thing that I'm going to do is position my patient. But I'm going to position my patient in my lap. So the one thing is when you worrying about focus and working in the mouth, working in the 12 o'clock position is phenomenal. It's awesome. Now, I know a lot of guys will come in this way, and I think that might be the way you were taught in dental school, and you might have practiced your whole career right here if you're a right-handed provider, and that's fine. And what it does is it kind of puts the microscope like this. If you want to see, I've got her up on the screen. Do you want to do the intraoral view?
Maybe on the laptop, hit the second one, intraoral, picture in picture. Picture in picture. There you go.
So you can see, nice nose ring, by the way. So you can see that the smile's off, and sometimes people like that perspective. But what I've learned is if I come over the head like this and kind of put the smile like this, and then now open, and then hand me a mirror. I better put some gloves on. All right. So let's just get familiar with just ergonomics a little bit around the mouth and what you can see in the 12 o'clock position. So, all right. Okay, you might want to get a section for mirror fog. All right, so I'm in the 12 o'clock position. I can obviously see that I'm in focus. We'll do a tutorial on focusing here in a second. But the mouth. So in the 12 o'clock, I'm just going to look at the screen so I can see what you're seeing. There we go. I can look all around the mouth. Now, there is a little bit of a difference when you're using your microscope for a presentation, which you're seeing on the screen here, and what I'm seeing through the eyes. So there is a couple things that we should talk about. So there's a working length here, the focal length from the patient to the microscope. And honestly, the farther you're up here, the more assistance space that you have. There's less constriction. And it also helps you keep your posture upright. And so I've learned to work, I'm only 5'9", but I've learned to work at a full 350 millimeter of working length here. Now this it's a variable focus on this microscope, and so I can go from 200 to 350, and so there's a lot of play between practitioners. There's a lot of height that you can do if you have different people working in your operatory, and so that's one thing, is to get a variable focus lens. And this fine focus is also very important, because as you are higher up at a higher magnification, you actually have a smaller field of depth, or depth of view, to stay in focus. So when you go from the anterior to the posterior, or the mesial to distal in the mouth, that depth, as you magnify, shrinks. And so you'll find yourself doing little fine focus like this. And what's nice about that is now, when you had loops, it's the same principle, but the loops you would figure out by doing this. You would bend. Or, you'd try to lift the chair or do something like that. And that's fine, but it kind of is going to give you a neck problem. So here, I can always just do this. And always just have a little bit of a tweak right here as you look on the screen. Now, so that's point one. Point two, if you do cameras, I've got another variable up here. This is a beam splitter, and then I have a variable up here where I can parfocal this for this. So let's talk about parfocaling then. All right. Let's see.
Can we get some some close-ups of those controls you're talking about?
Yeah, whatever you want's fine. All right, so you can put a mirror, I can put something down. Let's just actually draw a picture. So I'm at 1 magnification and corrected my working late. So you can see on the screen how I'm blurry and blurry. So I can just kind of get my first sort of attempt at focusing like so. And I'm just going to basically X marks the spot. All right. All right. And, you know, just kind of give me some marks. So, there we go. Now, if I change my magnification step, so from 1 to 2, there may be a little bit of discrepancies in magnification. So one thing you can do is start at the highest magnification, which is the 6 times here. And just kind of get that into focus. Then you can start backing it off and see if it maintains its focus. And, you know, that is parfocaling in its easiest form. Now, the problem is that's when you have a set distance, and this distance doesn't move. But the reality is people move, and you move, and your microscope arm's going to move. And so because of that, these little fine focus then becomes sort of the sweet spot for speed and efficiencies. And so this is a must-have on any microscope. Must-have. Because what you just observed is not necessarily practical because you're not working on a mannequin and you're not a robot. So I parfocal when I have to, and you do it more for doing things like this when I have a video feed. But in real life, I'm working at a comfortable magnification. Most of the time my magnification level is here or here, and between just 2 steps it's not difficult to keep those 2 steps in focus, even if there's a little bit of discrepancy. And as you can see, as I'm going back and forth, it's just maintaining its focus. So not a big deal. The learning curve is, and I know sometimes people say, well, I'm just so used to something. Maybe you've worked your whole career with loops, and you know, everything's sort of hard till it's easy. But right now it's riding my bicycle. I really don't think about these things very much. So even in explaining it, it's just sort of, how do you explain driving a car? So first and foremost, Pearl 1 is this fine focus. The second thing is, I would say, is position. When you get comfortable, like I was describing with Lindsay in the chair, just working in this 12 o'clock position, it's just more comfortable to then use my mirror and keep my posture correct. I think if you're having neck or back problems, that's something that is a huge advantage, a huge plug for the microscope. The other thing is what you see my elbows on. These armrests are paramount. You can sit down and having your arms sort of like this, taking the pressure off your rotator cuff, and in a nice position, it just kind of keeps things moving. And when you go around the chair, you're just actually using your rhomboids. Most people have neck problems, but when you fire your scaps through your rhomboids, you just really don't develop back problems. That and a little bit of Pilates is a must every morning. Anyways, so that's posture. Now, examinations. Let's go back to examinations. Let's actually do an examination and see the power of a microscope. So, Lindsay, let's get back into position. You can just use that over there. Do you want to get a patient napkin too? Alrighty. Good old Mirror and Explorer. right, so everybody's a dentist here, I suppose, so doing an examination is nothing new, but maybe just working around the patient and in the mouth is unique to this. So I'm going to do a little bit of parfocaling, and like I said, do you want to give me something to retract back here? If you want to get another mirror to pull back a cheek for me, and then just suction. All right, so we're going to look at her second molar. And there we go. Now I'm going to get you guys in focus on the screen, which is a different length than I'm looking at. There we go. All right, so Vic, you can hand me this Explorer. Now, this is the posture. And now you can see where I'm at, where my neck is at, Michael, and my body position, my arms and my shoulders, and my Explorer. And it can proceed to kind of inspect the quality of this restoration. There we go. So we can magnify this up a bit. And take a look at some fun defects here. One of the nice things too is letting your staff and your patients sometimes see your eye, what you see. It's kind of really nice to explain things. All right. Okay. Kind of fun. Looking at things, let's see. Can we turn down the brightness on that screen a little bit? Actually, I'm finding some defects worth fixing here, Miss Lindsay. So, looks like we want to do a little bit of repair work here. Yeah. Don't you guys worry, I have informed consent going on here. She works for me. Her dentistry's gonna be for free. So I'm just gently, as you watch me, I'm looking around the mouth, identifying some problem areas.
Maybe at some point we could talk about resting your eyes against the couch versus not.
Yeah, you got it.
Are you going back and forth?
That's the problem when you work for a dentist. You don't go to the dentist, huh, Lindsay?
Mm-hmm.
Man, but bite down. Let's see that pretty smile.
I know, how beautiful.
I mean, my goodness, she brushes and she flosses. Bite down all the way. It's a beautiful gingiva. All right. Okay, so a question came up about touching the microscope. So there's a couple things, and a lot of manufacturers do this part different. But it's the ability, if you wear glasses, contacts, if you have cups that come out. Now, on the Seiler scope, you have a couple things. First thing is you can adjust your correction if you have corrections in each eye. And this can give you your plus or your minus correction. Now, my eyes, I don't have any correction going on, so I will leave it on just neutral, and meaning there's no correction. The other thing is these eye pieces and this brand, can come out. And there's a lot of things to this. And there's actually different magnification levels that you can pick in the eyepiece that affects how magnified things are. In endodontics, I'm always working at a really magnified image. The other thing is your interpupillary distance can be corrected like here. And if you look, Michael, if you want to come down, you can see, and you want to go full screen on this.
Go the top one.
Picture.
No, go to the next one.
So if you want to go full screen, there we go. If you want to come down, I'm just going to come down here and show you. This is where you can adjust your interpupillary distance. And the nice thing about these little details is it's very easy to kind of sit in your cockpit and just kind of dial yourself in. It just takes a matter of seconds. So you can get your corrections set. These also, this particular eyepiece set actually can lock your correction in, like so, and lock into place. So you can, if you aren't sharing on an operatory, you can just sort of dial this into your liking, which I will do back. Get those things dialed in. And get this set. And what I always do, you can start wide and you're not, as you look through these, everybody's probably looked through binoculars or something before, but you're just making the two circles come together, and that gives you your broadest field of view. Now, if you rest your nose and your eyelids up into these cups, what's nice is the external environment just sort of dissipates, and you can get really focused and really into a funnel of.
Do you have issues with your back when you do that? More than sitting more upright?
So the question was, do I have issues with my back sitting upright? And the answer is I don't. You know what? I sit like this 8 hours a day, 5 days a week. I actually work 5 days a week, so I really don't. In fact, it's been, I think, quite nice for kind of burnout of body and posture. So this is a very natural, comfortable position. If I come back to my patient, if you want to get it on both feeds, if you want to go out and look at the whole environment, Mike, here, if you want to go out to a corner. Sure. So this is how I work. And you know what? There's always that wasted movement in space. But when I'm like this, things are always in focus. I'm in control. If a patient is swallowing or moving, I have access to the chin open wide. Very easy to kind of work around. But one thing is if you have these cups, what's nice, like I said, it blocks the light and the room around me becomes very small and I can work. But sometimes you'll start like using your eyes to kind of push things around as you're trying to see. And then you're always constantly kind of refocusing. And so other people like to push those things away. And when you do that, you kind of have a little bit more wiggle room. You feel less tight. Again, now your peripheral vision's opened up. You can kind of look out of the corner of your eye. Your neck's not doing this thing. You can look side to side with ease. And the other thing is then you're not touching your microscope. And so when you're at higher magnification like this, then it's something that's.
I have a question when you're ready.
It's something that you can control your focus. So when I'm not touching it, things stay still. So there was a question?
Yeah, Alex said, could you explain how you place patient's head depending on the arch you're working on?
So, yeah, one of the things that I'm stressing is in the 12 o'clock position, the arch actually does not matter. So Lindsay, you want to open? And when I'm looking at the lower arch, you know, I have kind of good direct vision. The lower arch is very easy to see. And there's always like corrections. So the articulation points to the microscope is in the arm, but in the microscope I have this ability, I have this ability, and then I also have this ability. And some of these corrections, like if you want to work from this side, you can put this microscope off axis like this, and then instead of my head being like this, I can rotate it back up and keep correction. And so, that was something that might be really helpful for guys who like where they sit and the practice of their ergonomics. If they're coming off axis like this, then this is something that is very useful with these corrections, as you can see the different articulation points. And on the lower, it's roughly direct vision. But when I'm in 12 o'clock, especially as an endodontist where everything mostly is occlusal access everywhere or lingual, then I just use my mirror and I can come in the same position, whether I'm looking at the maxillary or if I'm looking at the mandibular arch. So let's get me back corrected.
The same student, Alex, also asked if you could go through the magnification steps again.
Okay, so for focusing,
You said, I would also want to know your microscope's magnification steps.
so,
Maybe you mentioned that you're talking about.
all right, so Alex, when it's a question of focusing, right now I'm at the lowest magnification setting right now. These are a 12x handpiece, and magnification factors will be by this, where I am in my working distance here. Like I said, find focus first, and for the most part, this is like your 3 power loops that you're wearing, and very similar. You have, I think in general dentistry, in endodontics, we're looking for the little pinholes, and in general dentistry, you actually want depth of field and you want sort of position. If I go up farther, if I have something that's, can you see this whole distance? If you look at my screen, I'll get this in focus. I'm not a giant. I'm 5'9". I'm not a basketball player. So, but when you have longer distance, you get a bigger working field. And so I'm basically seeing, her entire face here. Smile. There you go. So, and it's easier to stay in focus. So if you open, you can just see everything that you want to see here. Now, when I bring it down at lower magnification, then people's tendencies are to start focusing right here. So I'll get my 2 lengths in focus. So here I am. Now the problem is, if I jump up to my highest magnification, I got blur. So you start focusing first at high magnification, and then when you come down to low magnification, you can refocus a bit, and that's where you get into parfocaling. And so if I were to make this letter X here, it's easy to kind of demonstrate what you're seeing. All right. So I'm at my lowest magnification, and I'm in focus. Now, if I go up to my highest magnification and tweak this in a bit, then I can remain in focus. So part of it is you dial it in at the shallowest depth of field, and then that'll let you to proceed. Now, like I was saying earlier, that's fine, and it's true when everything is static. The reality is people move, and you might bend over, and the chair might move, patient moves or swallows. So I find that not a useful trick, because it's really quick just to work at where you want to work, and then just fine focus things down here as I work. And so with my arms, I go back to her mouth. If I want to jump up in magnification, it's so quick just to do this business. and then I'm in focus. And so I will move my wrist like this often enough. And it's just real life. And it's just because you're working room to room, which speaks how you use a microscope in your operatories. So in my operatories, we work with microscopes in every room. And there's different doctors in each room. So there's a lot of like tweaking that goes along like that. And so it gets very comfortable. But I will always work in 12 o'clock because I will have access to the entire mouth like that. And again, the vast majority of people are probably over here, and that's fine if that's what you like. And then when you do that, you want to just sort of identify the features of a microscope that still gives you correct posture. So variable focus here, and then angle corrections up here, especially with this eyepiece.
Get in on that. Can you turn towards me just a little bit?
Like this. Yep. All right. The other thing, we live in this social media world of today, and I'm a Gen Xer, and so, it's not a big priority for me like the millennials and beyonders. But video documentation is really augmented with a microscope. I mean, when you try to go cameras off your loops, everywhere you look around the room, you're recording, and it gives the audience, makes them seasick, as well as your assistant. And so on a microscope, that image is always that image, even when I'm looking around or I'm talking to my assistant or to, an escort in the room, a companion in the room from the patient. Maybe it's a patient's mom or something. And if I'm doing video documentation or image capturing, or I'm wanting something to explain to mom or dad, it's really nice having this kind of in a static position. So the one advantage of having an adapter, like a beam splitter here with this is, especially with you guys in general dentistry, like I said, you can get this out of your head, and this gives you a lot more depth of field when you're dealing with a digital camera than your own eyes. And so with video documentation, I mean, I can come up as high as I want, and if you look, I'm under this microscope. And so, you could still use a microscope in loops, just kind of as a life hack, a dental hack here, and work around the mouth and with your loops. And just by having a microscope, it's quite nice to capture content, if that's something that's important to you. And identified nose rings. That's a nose ring.
It's important.
When it shows up on an x-ray, you can point here. So those are great questions. So I guess to review, when you go back to the ability to have an environment that you find comfortable, it's just like when you build a home, you really need to spend time in your environment and identify, I would say first, how your assistants work around the chair and how you work around the chair. And once you identify that, you pick the scope mount that makes the most sense. The second thing is, like I said, vibrations. Is I'm tapping my feet, I can tap my feet and that wall's not vibrating that image. But if someone's tapping on my wall or knocking on the wall, you're going to see that come through. And those little details drive you nuts. I mean, we're dentists, for crying out loud. Stuff like that drives us nuts. Ceiling is a great place to come down, like where this overhead light is. I've done a track system on it, and that's been fine. There's little drifting when that happens, but then you really have to be able to reinforce your ceiling well beyond what sort of code is. And it has nothing to do about a microscope falling off the ceiling. It has everything to do about vibration. And then you have to think about what's upstairs. So like think of this scenario. Think if I was on the bottom floor of this building and I had a bunch of rowdy endodontists upstairs. I mean, those endodontists, they love to jump around the room, right? People are screaming, babies are crying. So the reality is, if there's a lot of walking upstairs, you don't want it to vibrate your microscope if you have a level up above you. I'm on the second floor, and in one room, we had an air conditioner unit up there. And when that sucker kicks on, you'd be shocked how much vibration there is. So that resonance is not your friend, which is why I like the walls. There's not very many people that want to just knock on a wall in a dental op just for kicks and giggles. So it's a great spot to be. Now, disadvantage to that, by the way, point counterpoint is, what if you have a left-handed doctor in the room? And so that's where you would be really defining your space for right-handed, left-handed. Right now, I only have lefty assistants and no lefty doctors in my practice. I do have an associate that's coming in that's a left-handed doctor, and so we are actually flipping the rooms around specifically for him. But that's just something to think about. And that would be an argument if I wanted an ambidextrous room, then, you know, naturally going where this light is, or off left or right off the patient's knee spot, is a great place to go in the ceiling, because that can still work for both a left and a right-handed doctor. And 12 o'clock can work that way. It's just getting used to sort of an arm over your shoulder. Another question?
Yeah, question from Lucas.
Lucas, what a sweet name. Got a little nephew named Lucas. He's a stud.
He says, how useful is using a big LCD for projecting the image from the microscope? I mean, do you use only the projecting image without looking inside the microscope? Thank you.
So I think in general dentistry, that's not a bad statement. As an endodontist, no. I mean, as an endodontist, most people aren't wanting to look at a big TV screen like you want to show them this on the room. This is really because I teach procedures out of this operatory, and so that's the reason for that big screen, and people are standing behind me outside, over my shoulder outside the room. And so that's something that I do, and I put it right at the foot. And obviously you have to have a room designed to allow for that. It's a very comfortable space when you're working like this. If I was not in 12 o'clock, then I would put it over on this wall. Vicki, you're on the cord. I'd put it over on this wall, and you know, on my 9 o'clock wall, and I would look at it like this. But I think if you were interested in not using a microscope, you're in the way, not using the microscope and only using loops, but wanted video documentation, if that's what the question really was about, then you do what I'm doing. I mean, you can see that, yeah, I've got the light in the patient's pretty eyes here. Say hi, smile, show them your eyes. Yeah, now you're blind, seeing dots. But if you go up high, Michael, if you want to come in on the ring around her face, her eyes are closed because the light's in her eyes. And to overcome that, and it helps for patient privacy, you would actually put dark goggles. Do we have dark ones? Dark goggles over her eyes. And that would kind of help the fact that what you see cropped in and the ring of light here they're a little bit different. As you come down, you can control that light and keep it out of the eyes. And this is about 400, 450, which is very, very tall. And I couldn't work in that environment at that length here. I can get this back in focus for video documentation, but I certainly couldn't look in the microscope without sort of arching my back and expanding my rib cage to kind of stretch, which would be very uncomfortable. So you really want to know your length, your comfortable length, and I'm about 300. I'll stretch to 350 at times, and I can put her in focus, and this is my working environment. But if I come back up now with dark glasses on, see how cool she looks? And then I can get her in focus here. Now, you know, maybe you're too young. Did you ever see Happy Days? Do the Fonzie, like hey, you know. Let's see. That was actually, dates me, but I was a little kid when that was out. All right, so, you know, then it's better for her eyes. Now you can see her eyes through those glasses. She can see. It's not super that bright. By the way, if you look at the microscope, I'm not at full brightness. I was working about 40% right here. And these LED lights are so bright. Are you looking at that wall?
I'm looking at the scope.
Look at the wall.
Okay, go ahead.
So you can see the different lights, energies. Now, an LED light does a couple things. That will set your composite, first of all, and it will make your assistant see spots. There's filters. So you have the amber color filter for composite, and this one actually has a green filter for surgery. And it also generates heat. If you put, like if you can show where my hand is, you can feel the heat from that light on your hand. Just like a curing light, you can feel heat. So obviously it attenuates the further away you are. So I don't actually really run at full brightness. If I'm at magnification level 6 and I'm trying to identify an MB2, I will crank the light up, especially through like a zirconium crown or something. Then I'll crank that up. But otherwise, I usually run about 30%. So if I look here on my arm, there's a power gauge that you can see what you're on there. So anyways, you can see it. My room is all orange because I'm running around with the filter. All right, so let's just show the light intensities here on her front teeth. Let's get her back in focus. All right. Now, let's go down to the very lowest setting. Yep, let's hear the question.
This is Alex again. He asked, how does the green filter help during endo surgery?
So the green filter has to do with blood, right? And so when we say surgery, we're looking at periosteum. I want to look at a PDL. I want to look at a microfracture. I want to find the foramina of a tooth or a lateral canal. So it's really in that surgical space. It brings the contrast of the features between tooth, bone, ligament, granuloma. It just helps. It kind of gets a little bit weird when you're trying to do photorealistic photography. And so I won't use it that way. The other thing with surgery, if you really want to know these details, I really turn down the power. When you're doing a surgery on something, you tend to actually get really close. Like that's where, you'll get down to like the 200 range. And there's not a lot of splashing, and I'm really dialing in, and maybe her head's like, kind of cranked or something like this. And when you get close, you generate a lot more heat with the light. So I really will have it down on a low setting. If I were to crank this up, now this monitor is going to actually filter some of this brightness out just by the way that our technology is in this room. But it can get really warm. Mm-hmm. Can you feel the heat? Mm-hmm. See, she's getting a suntan. Now, and this one's got the olive skin. She likes that. I think it's her Greek blood, whatever you are.
You don't know.
But it's, you'll feel the warmth of that. And I'm on now full power here. So just little things to think about. And that's true with any light, right? I mean, that's not different than with the LED lights you use on your loops. So you could do a loop, a video hybrid if you wanted a scope just for video documentation. Back to the question on that room feed, that's really, like this LED screen that I've got here, or a projector, whatever you're into, that's really just up to your working environment. The other thing that happens when we're not really practicing right now, but there will be lens caps that you can put on. So for splatter for your lens, a bag that you can put over your microscope so you're not constantly wiping this down when you touch it, especially if you're doing surgery with bloody hands. And so that's something that you'll have to address by cleaning this or cleaning the underside of that lens early and often. Eyelashes, I actually cut my eyelashes, don't tell. But I cut them because they drive me nuts. They look pretty, but you flutter your eyelashes on these lens, just like if you were to wear glasses. That gets a little obnoxious. And I feel like when you're working under a microscope, sometimes you're really wanting to lean in, and when you want to lean in, you'll blink, and then when you blink, you get those wispy lines, and you don't really want to keep wiping those things, especially while working on a patient. And that would then be a plug why you would have the caps on, because then at least your eyelashes aren't like butterfly kissing the lens, and you keep it clean. But it's just the same if you wear glasses. I don't wear glasses, so if I wore glasses, that would drive me nuts. I would just cut those suckers off. So, great questions. So, Luca, did I answer your question? Rambled a bit, but talking to the universe, not to a person.
About the green light.
What about the green light?
Oh, that was just his question about the green light.
Oh, yeah.
I'll tell you if he comments.
Yeah. And who asked the question about the screen? Did that one get answered?
That was Alex.
Alex, you good with that?
Lucas said yes, thank you.
Okay. Lucas, give me another one. Give me another question.
Do you want to go through maybe all the pieces?
Yeah.
And explain how they can be tailored to any room or any configuration?
So with this company, Seiler, they have something called a high mount and a low mount. The high mount obviously is high, and sometimes just for where the room position is, you'll put it up really high up here. And then it has a swing arm that comes down, and just so when you're sitting, it's kind of at arm reach to where you can grab it and bring it over. And I think that's how the mount goes on the wall. As far as the way the articulating points, there's always different bends. So the bottom arm comes in different lengths. And then this arm on the Seiler company will always be the same. And this long boom actually gives you a really good working environment, a really good space. This thing, like I said, comes in different lengths, and that depends how wide your room is. These cords kind of have to do with the way that you fulfill that in the arm. Now there's actually a cover here that this is supposed to go in, but when they installed this cord is short, so I'm leaving this out intentionally just for my video documentation cables. If we walk into another room, you wouldn't see that it's configured like this, and so they're going to come back and replace this cord for me to make it longer so I can tuck this stuff back in. That kind of drives me nuts. Getting cords out onto, if you do this business over here with videos, it's really hard not to, although this will actually tuck up in this arm and just come out here. So that's kind of how that works. There's also different lengths of this arm, and this is kind of extreme because even though I always preach working in 12 o'clock, when I'm doing an apical surgery, I'm bending the chair. Let's say I'm working on the lower left quadrant, and this is the only time I break from 12 o'clock as an endodontist, when I'm working, especially a lower mandibular apico. And so then I'm going to want this extra reach and a kind of a kickback. And so I really appreciate this arm, this lower arm right here, in this fashion as I'm coming around like this. If my chairs didn't swivel to this one, I have these chairs because they really do swivel, and I'm sort of locked in place, then it even becomes more of a stretch. And then this is where we would come in like this. So, and the other thing is sometimes you will do this sort of lean back approach when you're doing, like, maybe if you're doing like a class 5, you'd be sort of reclining a bit like this. And I find that this top extending arm is really good for reclining if you want to sort of ease in, especially on the lower class 5, like so if she were to open up, bite down. So if I'm wanting to look like this and work like that, then That's where we go, like so. If I'm in 12 o'clock and I'm wanting to look at that facial surface, then obviously I'm doing it indirect with the mirror, and I'm coming in like that. And then I'm just working in the mirror like that. Except for you guys aren't showing what I'm seeing on screen. Like that. So, that's the arms. The other thing is, what if you like to stand, like doing anesthetic? People ask, do you use it for anesthetic? And I think, for me, I don't wear glasses and I don't wear loupes, so I only use this. So a couple of things, I'm always protected from splatter when these girls get a little wild with their air water syringe, or if I'm under rubber dam as an endodontist, it acts like a trampoline with fluids. So if I were to stand up here, if I were to stand up and try to do anesthetic, or I want to stand up, my patient's laying down, or if I move my chair up and bring her into focus just by moving the chair, and I want to use my microscope or anesthetic from standing up, this boom arm is fantastic because it gives me a ton of height. So we're not bumping heads, or if the patient wants to just jump up out of the chair and take a potty break, this longer boom, whether I'm standing or I'm sitting, is really advantageous. I can turn it so, let's see, I'm looking at your image here. So I'm 5'9", and I'm mounting this kind of just at ear level, I guess. And when I go like this, I have no problem standing around it. And I have no problem at that same height sitting and bringing it down. In fact, I could even come down and move the microscope right below my chin. So this arm length boom is something that I really like as far as just working around patients in the room. Let's see. That's a good picture of you, Lindsay. All right, other microscope questions.
Okay, this is Alex. Why did you choose this brand over the others on the market?
So, there's always going to be a little bit of a personality to a microscope, and there's no question they all do have personalities. And with that personality, there's a cost. And, the optics will always be an issue. And of the sort of the top tier brands, I think there may be some differences, but very little to negligible differences to what your comfort level is. And so what I think the most important thing is your ergonomics in the room. So once you know what your room's not going to really grow new walls, and I doubt you're going to want to reconstruct something in an office. So if you want to put a microscope in, the configurations that they offer is definitely a swinging decision between brands of microscopes. The selling points for me going with Seiler are as follows. One is this boom length that I talked about right here. This was very important to me. And other than my dangling cords that are going to be changed out here, ergonomically, I'm kind of vain. If you walk around my office, you'll get why I'm vain. But I like my microscope tucked up like that. So kind of it nice and tidy on the wall.
Let me get a profile shot of that.
Yeah. So
People can walk in into that chair.
yeah, there's a nice natural space here to where the patient's chair is, or the companion chair is, and it just tucks in, and then it's very naturally easy for me to reach and bring over to my patient in a seated position. And if I'm doing a quick consult and I want to stand up and bring it over, that boom in that position is very easy for me to actually do anything as far as standing dentistry or standing surgery may be concerned. And So they had me at that point. The other thing is because making video documentation for me was something that was very important. And there's like a GoPro camera, which is quite clever. And when we talk about parfocaling, it's one thing, a lot of companies actually will have this distance fixed right here. And I liked the ability to not parfocal. I'm not big on that because I don't find it practical as I'm working different rooms. And I know every microscope company will teach you about parfocaling. But for me, it's having the freedom, like with this variofocus, this fine focus down here, Mike, down here, I wanted this in my camera because it's very easy to have this corrected length up here as opposed to here. So for instance, as a talking point, I have this spot. This is not practical to keep in focus like so. But what if I'm wanting to talk about something and Mike show this camera, show my screen? This is kind of out of focus, but I have a lot more depth of field here than I do here. So this distance is not as affected because of this correction. So it gives me the ability to be this sort of extreme distance between me and the patient. I mean, look at that distance. I mean, we got like 2.5 feet here. There you go. And I'm in focus. But I would never be able to be in focus, nor is there a working distance here. If I were to focus here standing up, in my eyes, now I'm in focus by what I see, totally out of focus on that screen, and I can bring her into focus right here. So I like that video documentation ability of this beam splitter. Now, if you want to zoom in right here on this beam splitter, there's also a light game. And there's different cameras. Like I said, there's GoPro, which is really easy to use. But there's different, like the ability to take out light. So Mike, I'm trying to get right where my finger is. So this is a 50-50 right here. And over here is an 80-20. And it's just what it says. It splits the light. And so you just pick your camera and you'll pick the side that actually is set up for the type of camera that you buy on that point. And so this feature actually was a selling point for why I went with Seiler, as well as that boom arm, as well as just the aesthetics, tucking it up. And then the price point was correct for me.
The next question was about your eyepieces being upside down.
Yeah, so that's another thing that I've done. That is upside down on purpose. And I guess, like I said, they get personalities, but we're dentists and we'll do what we want, right? That's not how they'll tell you to do it. What they'll tell you to do is, and I've got all these little adapters on it. So this little piece right here is where you get your correction of your cant of your eyes. So if I have it at an off axis, this is a little extender piece. And because I work at 12 o'clock over the head, you need to go back. Zoom out over here. Because I work, go down here. Because I work at 12 o'clock over the head, this angle that's up here, go up. This angle that's up here extends my eyepiece over her head. If I work from like a side position, this becomes important for the correction, but the distance away is not that important. And so if I were to take this piece off, Vicky, will you hold my arm down since my weight's changing? Well, these things are balanced, so I'm going to have her hold that down. So this piece here, if I were to take that off and put my eyepiece on, which is sort of the more common configuration, it does a couple things. It's kind of nice to shrink this distance up. You know, as you start stacking these parts, this scope gets taller and taller. And if I were to take this beam splitter off, you know, you can see how small that would get here. You want to hold this for a second? If I were to take this beam splitter off, you got it, and put this on, which is how the scopes really come given to you, it'd be something like this. Now, if I were to sit in 12 o'clock You want to go out? If I were to sit in 12 o'clock, I end up getting a little bit of a lean for me over her head. So I like that distance because instead of leaning forward, I'm exaggerating it. I can lean back or I can recline. So I like this distance increasing over here. Now, I have it now flipped correct on this to where it says Seiler correct, and this is the way that they are. And when you reach, I'm reaching up above my head. So look at my shoulders now and how I'm lifting up. I mean, I can do military presses and would probably look fantastic with some really fantastic shoulders, which I don't have, obviously, because I work too much. If I were then, you're holding that. If I were to flip it like I did with this device, I'll show you what it does to my shoulders. So we can see this extension now. I promise I won't drop it on you, Lindsay.
That's all right. I trust you.
Did you hear that? She trusts me. Okay, so now I'm back into this right here. Focus. And this is just a better position where I'm leaning more, almost like more reclined, and that is really helpful for me and my body posture. And then, but now I'm still lifting my arms up. And again, I want fantastic shoulders for different reasons, but I don't want to do military presses for a living as a dentist. So if I were to then take this off and flip it around, if I were to take this off and flip it around, now look at my shoulders, look at my arms. See how they're tucked down? And this is a lot less distance to travel and a lot more comfortable. And then you get little narrow shoulders like mine.
More ergonomic.
I'm not that funny. And that's the problem. That's why I'm an endodontist, not a dentist. If I was good looking like Alex and Lucas and funny like Alex and Lucas, is it Luca or Lucas? Lucas. Then, you know, you want broad shoulders, so flip it upright, like they say. And you can do your presses and it'd be fantastic for your patients. Okay, so I'll put the beam splitter back on.
Vicki, could you? Oh, never mind.
Here, hold this.
Yeah. This is like my polycyst.
So I guess, you know, I guess that's the other thing. When you look at microscopes, these little tweaks that I'm talking about and why you stack and what your agenda really is are why working with the microscope and is really important. And I needed what I wanted out of the deal, and so Seiler really fit the bill on what was important for me. So yeah, that's my sales pitch for Seiler, I guess. Any other questions? Vicki, will you turn off those overhead lights?
Let's see. Yes, thank you. She was Brandon. Let me see. I pieced it upside down. Okay, Florina.
Florina.
Let's see. What products are you using for cleaning the lenses?
So there are. What's the? Hey, Linz, what's the cleaning wipes from the? Yeah, they're the.
Look on my phone. I have a picture.
Kimtech. So one thing that I really like is, and you can get it through, you know, Patterson, Shine, Burkhart's, whoever your suppliers are. But there's a Kimtech. They're wipes that you use in like a chemistry lab, and they're really fine. They're single use, and you can just boom, wipe them, throw them away. That's great, and I really like that. And Kimtech is the company that you use that with. The other one is you always can use micro towels and wash them. So we have a lot of these floating around, and then we use them and wash them. And I have what I've learned to use is I use an anti-fog, anti-static cleaner. And I don't want to sell brands because this has nothing to do about what I use, but it's anti-fog, anti-static cleaner. And it's really helpful for my wispy eyelashes that I keep cutting. And heat, if you run hot, Florina, then when you use a lens cap, your body temperature can actually fog, just like I live in Utah, so you know I'm a skier, and it's just like my lens goggles. And so I use an anti-static, anti-fog because then these suckers don't fog on me. Underneath, under the lens here, isn't that important because your assistants are always spraying water. And again, you can put a bag filter over it, but then at higher magnification, you can kind of see the bag or the cap. And they make disposable devices, but you can take this and clean it like so. And you know, this is something my staff will do in between every patient regardless, because you get to be kind of a lens snob, which is why I cut my eyelashes. How many times have I said that? It's a test question.
That's pure public knowledge, John.
Yeah. And then that's it. So you do have to clean the lenses. And like I said, you can go what the company sends you for disposable caps. You can wash with microfiber towels and wash. But from just to get in and out, especially in a general dentist, you guys see a lot more patients a day than I do. And I think in that kind of high volume turnover, I would use the Kimtech cleaners. Like I said, you clean test tubes and everything else with them, and they work fantastic. And Kimtech also makes a lens cleaner for it as well with their cloth. So, great question.
That's it. Good questions.
Okay. Well, I'm trying to think if I've missed everything. We've talked about position mounts. Number one, I think that is the most important mind frame, is look at your room, figure out your ergonomics, where you want your microscope mounted. When you think about that, you're going to think about how you walk in and out of a room, how your patients walk in and out of a room, and then you're going to think in terms of vibration. You want to think in terms of what possibilities, if you're upper level on a building, lower level, if you're ground level, you know, where your mechanical equipment is. You want to know those things. It sounds crazy, but it is so important. From a guy who's done it for 15 years and built 4 offices, it's like the thing that you want dialed in. So think about that. And that may influence with you where you mount floor, ceiling, wall. The other thing is left, right-handed doctors. If you're going to share a room, that's going to be something that you're going to want to entertain. If you're in your own practice and you own your own practice and you have your own home in a room, then you know what? By golly, put it where it makes sense. My recommendation would be right where it is. People thought that it would interfere with patient flow. I can enter my room from both right or left sides, but where I have my guest chair sitting, like I said, we talked about how this microscope tucks up on this wall. That was something that I wanted to have kind of fit the look and feel of my office, so that was a big selling point. And then I just didn't want to look at anything, even an overhead light. You know what, I don't really use that overhead light, but we put them in this office because I use my microscope light for everything, but we still put them in because there are different, like we have 4 doctors, so some guys still use that. None of our doctors use loops, but some doctors don't do examinations. The older ones, I do everything A to Z under a microscope. It's one of those workflow things. Once you get comfortable with how to focus and you get comfortable with positioning, you want an arm that articulates very well, and you want an arm that doesn't, when it's there, it's there. It goes up, stops, drifts. They can all be balanced out, but there's certain arms that balance out better than others. So another selling point for this company.
How about the paradigm shift of going from a non-microscope user to somebody adopting a microscope and learning how not to revert back, but really implementing it on a day-to-day. Any ideas?
Yeah, so the question and the idea was, God, you've been doing loops for how long? What would make you want to go to Seiler? And for a seasoned loop wearer, my biggest thing is going to be your posture correction. First thing is you're used to tucking your chin down, and that's something that looking straight ahead is going to be fantastic for your neck, but that little push-pull is going to affect how wide you want this thing. I mean, if you're not going to change how you are, and you are interested in a neck correction, then if you're a forward leaner, you don't want this length. Go shorter. But for me, if you want to correct a length, whether you're just trying to get a postural correction, I always get commented on the way that I sit. People always comment on my posture, and it's really because I've learned to sit upright with that microscope. So that would be one thing, is really just identify what you're trying to correct in yourself and what your call to action is. If you're doing it just because you want to make a movie, then you're going to want kind of this configuration here where you can just get this up and out of your way, and then you're kind of not really using the intended purpose of the microscope, but you're still using loops underneath it. So then you're going to want like 3 feet of working depth for a video or a photo. So you kind of just have to identify what you are. But when it comes to actually seeing and doing the dentistry, man, not having like this business and these type of filters that are put in front of your face, and you can control it on your microscope, and the ability to articulate that puppy any way you want in any direction. I still do indirect a lot with a mirror, so the microscope isn't taking indirect vision away from me, which you're comfortable with the mirror. That was never an intent in my mind, but it just, I can position and hold that, and if I need to move to another room, it's still there when I come back, and I get away from this with those filters. So those are really good assets to the microscope. I don't think parfocling, as long as you get these variofocus features, is an issue. It's mindless. It's like riding a bike. It's just tying your shoes. It's nothing that I even consciously think. You probably can hear me struggle even explaining it, because like it said, like, how do you explain making peanut butter and jelly sandwich? Like, if you really listed all the steps, it's kind of hard to do. It's just something my intuition is, and there's not really a learning curve there. I like 12 o'clock. I'm biased because I'm an endodontist, and occlusal surfaces at 12 o'clock are just anywhere in the mouth. Class 5 dentistry or apical dentistry for me, then these extended arms here are important, because that way I can kick my microscope and come back and look directly for more of a direct vision on any facial surface, like I said, during kind of class 5s or interproximal class 2s. Oh, it's too bad I am not doing a crown prep for you guys. Crown prepping under a microscope is phenomenal, like phenomenal, because you can see the shadows and you can see the details of your crown prep in a way that I can't really explain unless I could show you. Vicki, would you want me to crown prep a tooth? Could you imagine me as an endodontist crown prepping a tooth? But the reason why I know what I'm talking about is, come on guys, I'm an endodontist, and there's a lot of teeth that get fried after I shouldn't say it like that, that's horrible. There's a lot of teeth that need endodontics after crown prepping, and so I look at a lot of crown preps, and I can appreciate that. I can actually see the details there, and that's phenomenal. I actually have a prosthodontist down the street that actually uses one, and for the exact same reason. If you were asked him what his favorite thing about the microscope is he says it's crown preps. And it's very easy to posture that microscope, keep your correction, and see all surfaces, even like the distal lingual surface, which sometimes is quite hard to see. So yeah, I think those would be the biggest assets on using it. I made a comment, I said everything's hard until it's easy, and working with a microscope, believe it or not, is actually easy. It might seem hard because it's something in front of you, but then it becomes very, very easy. And I wouldn't actually do anything without it. So.
Any, how many years have you been using the microscope? Have you been using it the whole time you've been an endodontist, or? Yeah,
so in dental school, you know, when we were in the sim clinic, I bought a pair of loupes as a freshman and went from 4 years of dental school with loupes. When I was doing my rotation in endodontics in dental school, we had microscopes. And that was something that I just was attracted to. Like, it just made sense for me, and pushed really hard to standardize that at my dental school to get microscopes when I was a resident all the way across the room in all the endo rooms, which is what happened. And so as an endodontist, I classically was trained in residency under a microscope and then my whole career. So I actually have never done a root canal on a living person without a microscope, for the record. Not one. Well, that's not true. I lied. I just lied to everybody. I have. But I was in Haiti doing a humanitarian trip. And these girls can tell you, because they were there using loupes in that environment, I hated it. How much did I complain about my not having a microscope every day? So that's the only time I've done it. Great experience, great service, but wish I had a microscope. Anything else?
Any pitfalls to avoid, or any mistakes that you made on maybe early microscopes that could help?
Well, the microscopes have definitely gotten better. I mean, believe it or not, having an arm that can balance and stay imbalanced is, you can't speak, it speaks volumes to what's really going to frustrate you or not. Ergonomics, understanding the details of these extenders, these ocular extenders here, understanding the methodology behind beam splitters. You know what, you can make mistakes without kind of experience in that, and hopefully just me kind of talking out loud lets you see how my brain works and why some of these details are important. But like I said, this Seiler's beam splitter was a huge selling point to me. I'm not afraid to turn things upside down. That was important because I liked my shoulders not bench pressing or military pressing, and so that was something that was, once I was able to flip that around, the scope became very comfortable for me. I think we all drive in our driver's seat in a car differently, how we posture our seats. I think you'll find that the more features you have to kind of dial things in, the happier you'll be. So picking a company like Seiler that gives you a ton of configurations actually makes a difference. I think in the general dentist space, this ability to cant your oculars is really important if you work in off center, off a patient's head. The other thing is get dark glasses. You're probably already using that with overhead lights, but like I showed you, the light ring is different on a microscope. The heat difference is on a microscope. Overhead light is really high. And I've been through every generation. I remember just with a halogen light bulb, and then it was a xenon light was the next greatest craze, and now it's up to LEDs. And so LEDs are bright. Efficient but bright and do generate heat. The xenon really generated heat, and so definitely stick with an LED light for sure. Filters, the ability to filter is something that's a must. It's just you aren't going to want that light on a setting composite. It just shortens your working time down. And then actually, more than you would think, you don't work at high light power. I work more on a lower power. I find myself, the more comfortable I get with a microscope, I like the range of the steps. This is a 6-step, is another way of talking about a microscope. Different companies do different configurations. Some really like the math game and will tell you the magnification factors that are going on. I don't really care about that. But I have a 1 through 6 step, which is very easy. I usually work at 3. As an endodontist, I'll access and anesthetize at a 2. A 1 step for me is, broad field of view. It's really more for something that you're seeing today. I don't ever really use the one. 4 and 5 are really important in finding endoanatomy, so pulpal floor anatomy. 6, although when they do the steps, it's the incremental changes between the magnification factors, that the more subtle, less of a jump is why you like that, because as I go up in magnification, my depth of field goes down. So if I'm up at a 5, it's hard to actually focus on the occlusal surface and the pulpal floor. So just that 5-6 millimeter difference isn't all in focus, which doesn't matter if I'm only looking at the floor. But if I need to see the depth, then I'm backing off to like a 3. And so I like that incremental steps because I kind of tailor it for what the job is. Pulpal floor finding high, but if I'm doing a filling, then it's lower. So it's really important to have that. If you're like at a 3-step scope where the jumps are really big, then really the talking point is you're just really parking it in one lane and staying in that lane, which isn't as fun. The 6 is only if I'm looking at a crack and I have something very, very specific, very, very detailed. And when you're up at a 6, then I'm also cranking the light power all the way up in that. Mirrors are also really important. I commented earlier that I said, look, I do a lot with indirect. And so having a mirror that's not scratched, that hasn't been, put through sterilization 101 times, or going to a rhodium mirror, going something that's very bright is, you'll find yourself having special mirrors for the microscope or even for photography under the microscope. I use different mirror sizes. That also helps with positioning around like distal lingual line angles, things like that. So, but that I think that's true probably with loop dentistry as well. I wish I could ask the audience questions. We need to reverse the roles.
No more questions, and you've hit everything on the
Okay.
bullet point, right?
Well, guys, it was a pleasure. Mike, do you want to tell them if they have questions after the fact, if they want to reach out to us, what they can?
Yeah, I'm not on audio, but just keep watching Dental Learning Live.
So what you can do is reach out to any things that comes up under Dental Learning Live, and we'll reach out to you, kind of highlight. I'm sure the Seiler guys will be talking to you guys. It's been a pleasure, a little bit candid and off the cuff, which hopefully is real. That's the point of this, is to keep it as real as possible. But I will tell you this, going to microscope, you never go back. I don't care if you're an endodontist, prosthodontist, general dentist. I would even convince the surgeons to go microscopes if they listen to me, but they don't. But it really is a game changer. I think it extends the shelf life of your career. I think the tech nature of it wins confidence, the mind space confidence of patients. I think the ability to communicate in today's society of Insta and Snap and Facebook is phenomenal. Patients appreciate being able to episodically demonstrate something to an interested patient, and then also having the selectivity of closing it down for people who might find that disgusting to see inside one's mouth. I know in where I work, when I'm with other professionals, other even medical doctors and things, they love it. A lot of the surgeon specialties in the hospital are, Seiler is actually very common in the medical space. It's a powerhouse name, and you get credibilities with your peers in the medical space with that. Yeah, so.
If there's anything that wasn't answered in this class, something they want to see, tell them to comment. Any questions they have, any other classes even different from this, just tell them to comment anything in the comment section that they want to hear.
So if you didn't hear Michael talking, commenting's great. The more feedback we get, questions, specifics. If you want to see an actual demonstration, we can arrange that. Just let us know through the comments of Dental Learning Live, and then we'll go from there. So to the 3 people who talked to me, thank you so much. And that's it. Peace out. Cheers.